Good morning and welcome to another session of TAO's Resiliency series with Wendy Singer, who's Executive Director of Startup Nation Central. I'm Skip Newberry, President and CEO of TAO. A couple of rules of engagement before we start. All participants have been muted, so please remain on mute unless a member of the TAO staff calls on you to talk. You may ask to respond to questions in the chat box, publicly or privately, by directing your message to TAO admin or Ruthie Ditzler. We'll monitor the chat box and respond throughout the discussion. We'll ask you all to engage via the participant icon on your screen. And please engage with us on social media during this call and throughout the day. We definitely appreciate all the social support, and you can see where to find us on this slide that's posted here. Due to the limited time, we'll try to capture all questions in the chat and shift any unanswered ones to Mobilize, which is our online member engagement platform. Mobilize is TAO's member-only virtual community, and we'll post unanswered questions from our members there to keep the conversation going after the event. If you have any questions about joining Mobilize or TAO, please reach out to membership@techoregon.org. TAO staff support today is provided by Kara Turano and Ruthie Ditzler, who are happy to take feedback, questions, comments, or discuss sponsorship opportunities. It's now my pleasure to introduce Wendy Singer. Thanks for joining us today, Wendy.
Great to be with you.
Excellent. So you're a co-founder of Startup Nation Central, which is a fascinating organization. I was wondering if you could tell our attendees about how the organization got started and highlight perhaps some of its work.
Oh, sure, with pleasure. Well, I think it's pretty well known just in terms of the Startup Nation, which that tag name came from a book that came out about 11 years ago now that really told the story of Israel's tech and economic miracle. And if I had to crunch it down into one line in terms of the story, it's an innovation powerhouse. There's 6,000 plus startups, highest rate of VC investment per capita compared to any other country. But at the same time, Skip, not a secret that there's no market here. So the minute that any startup let's say, moves from the garage to becoming a real company, their entire conversation is with overseas markets. So Startup Nation Central was born about 8 years ago to connect Israeli technologies with global challenges. Now, we do that in a couple of ways. I think first and foremost, and perhaps most relevant to the Oregonian businesses and tech people that are with us on the line, is that we did a deep mapping of the whole tech ecosystem here. All the 6,000 plus startups, all the VCs, all the R&D centers, even the technologies coming out of academia, and we put it online. It's called startupnationfinder.org, and it's free. And anyone that wants to peek under the hood in terms of what's happening in Israeli innovation, it's a great place to go. And they'll find, however, it's well tagged, whatever sector, subsector, technology you're looking for, you'll get a sense of what the startup is, what their funding is, what their target market is, and so on. And the second main activity is we actually are hosting Fortune 1000 companies that want to come to Israel and connect with the tech ecosystem in some way. They do that by sharing their pain points with us. And pre-COVID, we would actually host them live in our building and curate a very, very customized day or two where we would introduce them to potential solutions for their tech pain points that could be found in Israeli innovation. Just to give one example, because I think it's an interesting one that our colleagues on the line can relate to. We hosted BNY Mellon a few years ago, who sent a C-level visitor to Israel for 2 days. Having shared their particular issues and challenges, we exposed them to some 30 plus potential solutions. They understood that they couldn't afford not to be in Israel. And as a result of that visit, they now have 48 people on the ground. So that just gives you a sense of what some of the activities are.
That's fantastic. And that's one of the biggest issues I think startups here in Oregon face as well, is access to markets outside of Oregon. We're a tiny market and they have to be export oriented in a sense from day one. So that's a great parallel there. So I was wondering, in terms of the pandemic in Israel today, if we could maybe kind of ground ourselves in some of the numbers. So what are the infection and hospitalization numbers currently?
Okay, so in terms of new daily infections, the latest day that I have is 234 cases in a day. And just to give you a sense of the meaning of that, that's down from about 10,000 cases per day that we were looking at in January. If you go back to September of 2020, it was 11,000. It's a pretty dramatic decrease. Right now, we've got 2,270 who are infected and 323 people in hospitals. The virus reproduction rate, or the R naught, as they call it, is 0.77, and that was really the big index in terms of how the policymakers could make decisions in terms of getting out of lockdown and so on.
Mhm.
And I know that these numbers, I think that Oregonians can relate to them because we're about a little more than double the size of the population of the state of Oregon.
Excellent. And in terms of the rollout of the vaccine, what did that look like, and what made it possible in terms of the dramatically quick execution that occurred over just a matter of months?
Okay, well, in terms of dramatically quick execution, you have to remember that Israel is a country that knows how to mobilize resources in the case of an emergency. So just start with that culturally, okay, as your starting point. But if I really have to, I have to break it down. I'm going to say into 4 pieces, and I also need to go back actually a few decades, because prior to the establishment of the state of Israel, the early founders of the country made a decision that healthcare is a human right. And that means that from the early days of statehood, a decision and a policy was implemented that 100% of the population has to have access to healthcare. So full healthcare was vertically integrated. Now, the second piece of that is, okay, that's a pretty ambitious goal. What does the delivery vehicle look like for that? So healthcare is state-sponsored. Now, it shows up in terms of the vehicle into 4 HMOs, health maintenance organizations. Think of Kaiser, Permanente. And these are all nonprofit as an entity, but they run in a competitive market. So 98.5% of the population is covered by these 4 HMOs. Now, the third piece, and I'm getting right to the heart of your question. The third piece is digital, digital, digital. And if you want to hear more really about the depth of the digitization of the healthcare system, there's a great podcast that a colleague of mine was interviewed on called Post-Corona. And the topic was Vaccination Nation. And my colleague, Jonathan Adiri, who's the founder of a pretty hot digital health company, really gets into this. But he basically goes on to say that since the year 2000, 99.5% of the population's medical data is found in EMRs, in electronic medical records. Now, Skip, that's 20 years of data. In 2012, the whole system went mobile, so that each HMO administers its services, yes, in the old school way of calling up, making appointments and things like that, but basically through a mobile app, website, and sending texts. So you've got a sort of a very embedded healthcare system with tons of data. And a few years ago, they went a step further and started connecting between, data from going to visit your physician, data from your visit to the pharmacy, and data from your visit to the hospitals. So the final piece of this is, if you fast forward to 2020 and you're looking at a global pandemic and you need to do a massive vaccination operation, each HMO was able to systematically reach out to its patients based on their age, their risk group, and their medical background without a hitch. Now, the stories of the efficiency of this operation are pretty remarkable. It sounds to me like similar to what's going on in Oregon now. I mean, each HMO kind of took over a sports stadium, a convention center, community centers, even areas at the entrance to, vegetable and fruit markets. And all you had to do was go onto the app of your HMO, see what location was closest to you, book your first appointment. There was even some, a lot of jiving going on Facebook. I was in and out of the Teddy Sports Stadium in 18 minutes. Okay. And so that really what the efficiency was stunning. Now, this was all well and good. Oh, by the way, you would get your text about the location and date and time of your second appointment immediately. Now, this was all well and good for the older and the higher risk population that were pretty hungry to get in there and get the jab, so to speak. But they quickly got down to parts of the population that were less aggressive about wanting to get the vaccine. And that then required each category, not only demographically, but in terms of age groups, required its own strategy. This is what I call where you got to know your audience. And there was a big food element that went on here. I mean, in the Israeli Arab community, they were giving out knafe. If you would get a vaccine, knafe is a delicacy and sort of a sweet delicacy that Israeli Arabs are very fond of. In the ultra-Orthodox community, it was cholent, which is like a bean stew that they would give out, and so on. Israel's a population of 9 million people. Now, at its peak, there were 150,000 vaccines being given out a day. So we're talking about 1 to 2% of the population. So just in a nutshell, if I take all those pieces and put them together, it's a combination of a very well organized and digitized healthcare system, community-based, which meant that people were very, easy to reach, and efficient communication channels.
Well, that's great. I mean, that's a really, kind of clear, concise sort of breakdown. And I think that what's interesting about it is that parts of it seem very attainable. Other parts, in terms of the interoperability issues, the outreach, the data, that seems to be a consistent stumbling block here in the US, is how to collect, organize, and make sense of the data across all these various disparate systems. In terms of the focus on the local population and vaccination, so there's been a large portion of the population that's been vaccinated to date. So of those who remain, who may have some hesitancy or what have you, like, what's the strategy for reaching out to those folks?
All right. Well, first of all, I would say that the public policy system is really looking out to those folks based on different categories. So you've got people who've had COVID, people who have natural immunity, and of course those who were vaccinated. And essentially each group requires its own strategy. As I mentioned before, they got a lot more creative and a lot more aggressive in terms of, what are the incentives that we can offer. I think that as the weeks went by, they also, in each HMO, made it more and more frictionless, so that just the act of going out and getting it done just became easier and easier. But in terms of the ultimate, incentive to your question, I would call it positive discrimination, so that those who are vaccinated, they get something called a green passport. In Hebrew, it's called a tav yarok. And once you've got that QR code on your phone, you can get into anything. So we're talking sports events, dance performances, concerts, stores, hotels, and the list goes on and on. So soon it literally just becomes a question of, do you want to operate in a larger public space, or do you want to be confined to a much smaller space? And then, and just because I think this is very pertinent to some of the things that are going on in the US, and certainly in the state of Oregon, it also starts to open up a lot of kind of legal issues and societal issues. in terms of how does a government govern a mostly vaccinated population. And here is where I think in a country like the US, or even think about a country like Germany, where you've got different levels of government, right? In Germany, you've got a federation of states, each of which has its local, governance. So when you have a state level and local level and municipal level, and then the national level in the US, some of these issues can get more complicated compared to a small country.
That makes a lot of sense. In terms of the story about Pfizer choosing Israel as its testing ground for the vaccine, I think that's also fascinating because it underscores some of what you talked about earlier and some of the work at Startup Nation Central, which is bringing in large companies to do innovation and connect with startups in the ecosystem locally. So I was wondering if you could talk a little bit about why Pfizer chose Israel as its testing ground for the vaccine.
Well, I think at the end of the day, Pfizer saw an opportunity to roll out in a country that could be imagined as a post-corona laboratory. And so the answer is why. The CEO of Pfizer did a really interesting interview on Channel 12, and he's since had all kinds of interviews that related to their decision. I would have to break it down, as does Burla, into three basic reasons. The first is the tiny population. Okay, again, a bit more than double the state of Oregon. The second is the healthcare infrastructure, which I talked about earlier. But there is, in his mind, a ready-made infrastructure that Israel had in order to distribute the vaccines. It was just super logical, and you could imagine the end game. But the jewel in the crown, of course, is the data collection opportunity. I'd argue that was the real reason why Pfizer just put a finger on Israel. It included, because of, again, all these EMRs and everything that they were able to get in, at a rapid pace, the results of the vaccinations, the side effects, the efficacy, the amount of time it took to develop antibodies to fight the virus. So if you put all that together, and then Pfizer also had willing partners in the system here. The name that jumps out, who was really kind of the poster physician that helped put all the pieces together, is someone named Dr. Ron Balitzer, who is the head of innovation for the largest HMO in Israel, Clalit. And he was basically creating enough data for there to be kind of a digital version of a clinical trial. And that led to an article in the New England Journal of Medicine a couple of months ago, which basically gave the results of a trial with 600,000 people just a few weeks into the operation.
That's great. I think there's some lessons there too for as we think of Oregon as a place that's small enough where you can test something, and if it goes sideways, people aren't going to pay attention. But if it's successful, it's great. You can then tout it. So as we think about the strategy around what other governments can be doing, what would you recommend that other governments do to be better prepared in the event of another pandemic? What are the lessons learned?
So I think the biggest rock, and we've actually, our research team at Startup Nation Central has spent a lot of headspace on trying to answer exactly that question. But I think that the biggest rock is to both endorse and adopt digital innovation for healthcare. Now that spans from, remote care and telemedicine, remote diagnostics, decision support systems. A lot of these areas that involve, deep tech are areas where Israel is particularly strong. But we actually put out a paper in September, so it's a few months old, but it is on our website at startupnationcentral.org, and it sort of is almost reads like a playbook in terms of what are all the areas in digital health innovation that governments can think about now in order to be better prepared for a future pandemic. The other piece, if I just go a little more granular, is again back to the vaccine operation, because we have to believe that it's back out there at some point. And I would my biggest insight is to make the whole thing convenient and create a momentum. I mean, that really are, in some ways, were the calling cards of how it was pulled off here. You have to make it easy to get an appointment. That, if it's convenient, it creates a momentum. It becomes frictionless. And that in and of itself reassures people that it's okay to do this. So those are my thoughts in terms of what governments, what policymakers should be thinking about.
I think that's great advice. And there were a couple of questions we got from some of the participants that are nice sort of corollaries to that one, which is in terms of political crisis, with multiple elections not yielding a stable government. How did Israel succeed in spite of some political discord or mayhem? You could argue it's been the same in the UK. We've had some issues here in the US, putting it mildly. So what would you say has been sort of the reason for the success in Israel, despite some of that mayhem, the chaos, if you will, politically?
Oh, that's such a good question. Okay. Look, this is a country that culturally knows how to deal in mayhem, to use your term, for better or for worse. Okay. So I would say that both things are true. In other words, we had 4 elections in the space of 2 years and a lot of political protests going on. And at the same time, the bureaucracy and the relevant ministries, if you will, were in this sort of massive rallying mode in order to come together and rise above, that term mayhem that you used. So you had the Ministry of Health, you had the Defense Ministry, you had the National Security Council, and you even had some of the sort of the big players in the tech world getting involved. And all of that really goes to what I'm going to say, broadly speaking, about Israel, which is that we are a very informal country with disrespect for hierarchy. And that means that by nature, situations like this one, which was a real crisis, but even where you see the innovation going on in the day-to-day work of the tech ecosystem, it's kind of a big mashup where it's easy to reach anyone that you need to reach, and collaboration between government and academia and corporates and startups, young and old, is seamless. So I think that's a big part of why that was allowed to happen, despite the political noise in the background.
Yep. And a related, sort of question, I think, is, as we think about opening up and strategies for kind of getting back to whatever the new normal is, vaccination is a piece of it. And so I'm wondering, what are some of the other things strategy-wise that are allowing Israel to open up?
Gosh, I still think that it's back to the emphasis is getting such a high level of the percentage of vaccination. It's all the things that I think that you're well aware of, but getting to the point of the herd immunity, that opening up every single layer of the economy just starts to be, I don't want to say seamless, because that would be an exaggeration, but that it becomes much easier to do. And then again, as I mentioned before, you have to start considering questions like, what is the meaning of governing a mostly vaccinated population? You've got legal issues, you've got privacy issues. You have situations which we even had a dilemma in our organization where 99% of the team was vaccinated. And what about the 1%? it becomes a real kind of an ethical / legal set of dilemmas in terms of going back to work and the physical workspace and so on. So a lot of these things are very much on the table right now.
Mm-hmm. Yep. And, we've got, let's see, a couple minutes left. We might have time for one of the audience questions here as well that I could work in. So one question was, someone said, as a former pharma rep, I saw the impact of managed healthcare up close and personal. What is managed care's effect on the medical field, if any, in your country? And is that what we are missing here in the US, care for cash over healthcare?
Oh my, okay. I'm not, I've got to think about that one, because I think that we don't have that experience. In other words, it's not a world that Israel knows. Since 1948, it's been this state-sponsored healthcare system. So I grew up in Canada and spent many years in the US, so that, that's my point of comparison. But I would make the case that having these state-sponsored healthcare delivery vehicles that still have to be competitive, because there's 4 of them and one can move between one and the other, does volumes just in terms of the universality of the coverage. So that would be my yeah. Also, right. Skip, I just want to suggest, particularly because I know that the tech ecosystem in Oregon is so robust, and I think has actually, for half the population, almost the number of startups that are in the state of Israel, that if anyone who's with us would like to take a deeper look at some of the digital health innovation that made this whole story possible, that they may want to take a look at the Startup Nation Finder. And again, you can just put in digital health or any subsector within that, and they can find that very useful. I know
used that personally, there is a ton in there. I mean, it's like Crunchbase on steroids.
That's great.
Yeah.
And the other thing that I know that our time is running up, but the other thing I just want to leave you with, just because I think it's particularly for the different people in the tech world and in the policy world that are with us on our show here, that one of the most important things that I can say, sort of broadly speaking, about the tech culture here is actually something that our late president, Shimon Peres, said at one of his conferences, where he said, the greatest contribution of the Jewish people to humanity is dissatisfaction. So I know that because of the robustness of your own tech sector there in Oregon and the success of so many of your companies, I just think not only do I want to wish everyone who's with us good health, but that you should continue to be dissatisfied. And that will drive you to go a long way.
Well said, and a great closing remark. Wendy, it's been a pleasure having you on and chatting with you. Thank you for your time. I know you're really busy. And thank you to the folks who are able to join us live, and we'll have others catching this asynchronously as well. And so we'll continue to capture any unanswered questions, follow up with Wendy and her team, and see if we can get some brief written responses on any we didn't get to. And just wanted to say thank you again to everyone who participated. And thank you again for the companies that helped make this possible, CareSoft, and also support from Google along the way. So we really appreciate their support for this series too. So thank you again, Wendy, and have a great day, everyone.
Great to see you.
Thanks.
Take care. Okay.
Thank you.
Bye-bye.
Bye.